FDA has no real regulatory authority. At least they say they have no regulatory authority. It's like the Wild West. FDA has blood on its hands. FDA has responsibility.
And someone should go to jail. I repeat that.
About 60,000 American soldiers were killed in the Vietnam War. And we have a Vietnam War memorial right here in Washington, D.C. that has the names of those 60,000 American soldiers engraved in granite. It's a very somber, very moving memorial. Vioxx killed that many people in the United States. But we don't have people protesting in the streets saying, stop the war, end Vioxx, you know, let's get FDA to work for the American people.
My name is David Graham, and I'm pleased to come before you today to speak about Vioxx, heart attacks, and the FDA.
Vioxx is a prescription medicine for the most common type of arthritis pain, osteoarthritis.
I can only say that I had a healthy heart, and I was pretty active and I was pretty healthy before I started taking this medicine. Then, a while later, maybe a year later, I had a heart attack.
Scientists have testified that Merck was aware of a potential risk of heart attacks from Vioxx since 1996, 3 years before it came on the market.
In November 1996, Merck scientists hypothesized that patients taking Vioxx would have higher rates of heart disease than those taking an aspirin-like comparison.
Dr. Villalba, the FDA officer reviewing the application for Vioxx before approval, noted that patients taking Vioxx had more heart attacks and strokes. In summary, a larger database will be needed to answer this and other safety comparison questions.
Bless you for writing it, because you kind of got it right back in 1999. So, I mean, how do we balance that? I mean, the FDA says, God, this person over here who's a scientist is telling me that we need a larger database to answer this and other safety comparison questions, i.e., does it cause a greater risk of heart attacks? And yet you approved it at the same time. How can that possibly be?
Merck conducted a number of small, short-term clinical trials of Vioxx. By the time of approval in May 1999, only 371 and 381 patients had received doses of 12.5 or 25 milligrams for 1 year or more. These studies were not adequate to evaluate the effects of Vioxx on the occurrence of heart attack and stroke.
I am Peter Rost. I'm a Vice President of Marketing at Pfizer, the world's largest drug company. I speak on behalf of myself, and I don't represent Pfizer in what I'm saying today. The big issue is not necessarily the trials that we do, but the trials we don't do. The results we don't see. That is something the physicians and the patients never get to see, because the companies know it wouldn't show the drug in a favorable light.
Fundamentally, they chose not to ask the question about cardiovascular answers, but the lack of evidence about a drug is not evidence that the drug is safe.
When the Vigor results came in, which was in about June of 2000, it was very clear immediately from that study that Vioxx increased the risk of heart attack by a factor of 5, so it increased the risk 5-fold.
The thing that's very interesting about the Vioxx scandal is that the company knew a great deal about the adverse effects, the bad effects of Vioxx, and nevertheless continued to promote it.
All I want is to get out here early and surprise a few clams.
Ask your doctor today about Vioxx.
At the time of its withdrawal, after the cardiovascular risks were confirmed in another major study, over 100 million Vioxx prescriptions in the United States had been filled. We now know that many of these prescriptions were dangerous and unnecessary. Overprescription of a dangerous drug can be a public health disaster. In the case of Vioxx, Experts have estimated that as many as 140,000 Americans may have suffered unnecessary heart attacks and strokes and other serious medical complications from the drug.
Here we're talking about a very significant increase in risk of heart attack, which is the leading killer in the United States. And FDA had that information in its hands and did nothing with it.
My doctor gave me the Vioxx for pain, for arthritis, and stiffness and everything, and I didn't know the side effects that came out later on from Vioxx. I palpitated a little bit from the Vioxx, where it was supposed to take away the pain I have from arthritis. I felt jittery from the Vioxx, and I stopped it.
Is that enough water?
Yeah, that's it. I didn't make it as strong as you like it.
When I had my heart attack, I was taking Vioxx.
The lies. Pinocchio and Big Pharma may have something in common.
Drug companies lie left and right, and they get away with it. Companies are experts at treading that semantic line, that legalistic line that says, well, if you dissect, parse out my words, I told the truth. But if you take the whole sentence or the whole paragraph, the message that they conveyed was a lie.
On September 17, 2001, the FDA sent a warning letter to Merck and to its president and CEO, Mr. Gil Martin, stating that its promotional activities for the marketing of Vioxx were false, misleading, discounting the 4- to 5-fold increase in heart attacks, raising significant public health concerns.
We took that very seriously. Those letters are strongly worded.
The warning letter goes on to say, Merck's press release dated May 22, 2001, titled Cardiovascular Safety of Vioxx was also false and misleading. Merck's claim that Vioxx was safe for the heart was labeled by FDA simply incomprehensible.
Well, I don't know who wrote that press release, but boy, I'd have a serious talk with them.
There was no action requested or required on the press release.
But very often these letters, they go out months after this advertising already happened. So it's not necessarily very effective.
Then FDA says, oh, you broke the rules, slap them on the wrist, and the company will say, okay, we won't do that again. By that time, they're off doing another ad campaign that breaks the rule again.
The FDA has a relationship with drug companies that is far too cozy.
The label fight. When Big Pharma and the FDA wrestle, the winner decides what to print on the drug label.
It was clear that the drug increased the risk of heart attack, and yet the company fought against FDA so that it wouldn't appear in the labeling.
Nearly 2 years passed before any label change was made by the Food and Drug Administration.
We agree that these negotiations took longer than they should have. They took longer than is usual.
To a drug company, every day on the market for a new drug is worth $2 or $3 million.
We were trying to work out exactly what was acceptable to both sides.
When all this fighting went on between the FDA and Merck over 2 years, and then what was the outcome of this 2-year-long match?
FDA did a label change in 2002 that was a very weak label change and that did nothing to protect American people from injury.
The FDA allowed itself to be manipulated by Merck on labeling changes that became necessary after a review by Merck that's known as the Vigor.
The ads. When you fall for an ad, you may buy the wrong detergent or a killer drug.
Merck spent over $300 million on consumer advertisements for Vioxx. Probably everyone in this room saw Dorothy Hamill on television, skating in circles.
It's a beautiful morning. Ask your doctor about Vioxx.
I don't listen to it. It's somebody who wants to sell me something. It's propaganda. And if you listen to it and simply believe it, then you're pretty foolish.
When you fall for an ad and you take medication you don't need, is it really your fault?
Vioxx. Vioxx. Vioxx.
My first heart attack was in 2003. I had had some surgery and I had a heart attack afterwards. And then about a year later, I had another heart attack.
Merck puts patients first.
Merck tried their best to disregard all the information that was coming out that Vioxx was bad for people.
Merck, where patients come first.
Whenever I see something like that on television, I feel outraged over it because I'm dependent on medication to help me to get by each day. And to know that I might be taking something that will give you a heart attack and perhaps even cause your life, it's terrible.
My name is Marcia Angel. I'm a physician, and I am now senior lecturer in social medicine at Harvard Medical School. And I used to be editor-in-chief of the New England Journal of Medicine. In the case of Vioxx, it was not just a hint that the drug might increase the risk of heart attacks and strokes. It was out there. It was out there in black and white, but it was buried. Buried in plain sight, that's probably the best way to say it. Merck had no interest in following up on the indications that Vioxx increased the risk of heart attacks and stroke. And in fact, it was about that time that they hired Dorothy Hamill for this huge promotional campaign to sell Vioxx on television, which worked. I mean, it made Vioxx a blockbuster.
A blockbuster drug became a blockbuster disaster.
100 million prescriptions were sold. They made $5 billion on this. I mean, you're talking about major money, and they spent all this money on advertising, and they knew damn well this stuff was bad.
There were a lot of reports and discussions about these risks with Vioxx, but I heard it, my friends heard it, some of them stopped using Vioxx, but the regular patients never heard it. They only saw the ads.
And find out what Vioxx can do for you.
The risk of a heart attack in a man who's 65 to 74 years of age is 1 in 50 in a year. A 5-fold increase means that that risk now goes up to 1 in 10. And the average typical patient treated with Vioxx is a 67-year-old man.
Whenever they put something on television, it's so quick and so fast, it flashes in front of your face. And you remember, what you remember is, take this, take that, take Vioxx.
Vioxx.
And you're not even thinking about, will this hurt me or my husband?
The sales reps. Why are sales reps giving out free dinners, gifts, and trips? Are sales reps telling the truth to doctors?
Ask your doctor about Vioxx.
Yes, ask your doctor. But what exactly does your doctor know about drugs?
Actually, that's a good question. I really don't know. It's very minimal with the side effects because it's a very non-abrasive product.
Very safe. The only main side effect is somnolence.
I took Vioxx because I had a lot of pain from my arthritis, and the doctor recommended that I use it.
My doctor prescribed Vioxx.
I got free sample of Vioxx, in fact. The doctor gave it to start me off on it right away.
Often the companies have given doctors free samples of the drugs that they advertise the most, so that the doctor can just hand it to the patient right there.
But what I can do, we can have samples sent to your office.
And then, after the free samples run out, both the doctor and the patient are hooked on the drug in a sense. They're not going to go to any other drug.
I think doctors should be more well-informed.
There are probably over 100,000 drug company representatives now visiting American doctors every day. They are everywhere that doctors are. They're just a huge presence in the life of American doctors.
My success would totally be measured by the amount of prescriptions that was generated. The pharmaceutical companies had a way to track the data based on the doctor's DEA or medical license number. And so every prescription they would write or generate and that gets filled, it will get tracked. And they'll be able to see how well your territory did. That's how your success is measured. And ultimately, based on your success, you are given a bonus at the end of the quarter.
Merck employed more than 3,000 sales representatives to promote Vioxx to doctors and hospitals. These Merck representatives were extraordinarily well trained. Our committee has examined more than 20,000 pages of documents. These documents show that Merck trained their sales force to exploit virtually every interaction with physicians. Merck and the drug industry say that the role of drug representatives is to educate doctors about new products, about new medical research. But the documents tell a very different story. The goal was sales, not education. Merck representatives were instructed to use subtle gestures subconsciously to gain the trust of physicians.
This slide is used to teach representatives how to use nonverbal techniques involving the eyes, head, fingers, hands, legs, and overall posture, facial expressions, and mirroring. My goodness.
Health risks were viewed as, quote, obstacles, end quote, that the sales force was instructed to surmount.
I am confident that those policies and procedures and our training methods for them ensure that our representatives present to physicians the information in a fair and balanced manner.
Instead of informing doctors and patients about the risk, the Merck sales force was instructed to show doctors a card that stated just the opposite of the scientific data, a card suggesting that Vioxx is 8 times safer on the heart.
This cardiovascular card was inaccurate and misleading.
Our policies and procedures are in place so that we present accurate and balanced information regarding the product. So we don't go one side or the other with regards to benefit and risk. We make sure that the information is accurate and is balanced and is consistent with the label.
These people are used car salesmen, and used car salesmen will even sell a used car to their brother, which they know is junk.
I don't want people in my district or anywhere in this world taking drugs that can lead them to heart attacks, and then they're getting inaccurate information. That's crazy, and we're paying for it.
The cards that we are providing are accurate, balanced, and fair.
This is called lying, not balanced information. It's selective, it's manipulation is what this is.
11 months after the Vigor study, an FDA advisory committee met to consider the study's implication. The committee concluded that doctors should be advised about the risks that Merck had found.
So that was unanimous.
But here's how Merck responded. The very day after the FDA advisory committee said that doctors should be informed about the Vigor study, Merck sent a bulletin to its sales representatives that stated, quote, do not initiate discussions on the FDA advisory committee or the results of the Vigor study. When it comes to the one thing the doctors most needed to know about Vioxx, its health risks, Merck's answer seems to be disinformation and censorship.
Can the FDA stop companies from giving out false information?
We have strong regulatory tools that we can use and that we do use to enforce our promotion regulations. Companies are not allowed to provide false or misleading information to physicians or consumers, and we send them letters and warnings and additional regulatory action and fines when they don't follow the rules.
I mean, people are dying as a result of this. This isn't just, well, shouldn't do that again.
Right.
They were understating the incidence of cardiovascular mortality to doctors as a marketing tool.
There's very little to counter the pharmaceutical marketing activities. You know, the major drug companies in the United States spend about twice as much on marketing as they spend on research and development, about twice as much. The top companies spend on the order of $70 billion a year on what they call marketing and administration. Most of that is marketing.
You have to be careful. You don't always know why a doctor prescribes a particular drug. Unfortunately, that's the situation we have today. The doctor might think that a particular company has a young and sexy and beautiful young sales rep, and he wants to sell more of her drugs. Or the doctor may have been taken on a trip with these drug companies.
Everybody
going to take 2 baby steps towards me because I did bring the cash today. Yes, I did. Can you step in, doctor? Yes, touch the money. It's actually real, isn't it? Dr. George, is that a real dollar, sir? Yes, it is. Turn the bill. Is that a real dollar?
All of the gifts, the trips, the tickets, the lunches, all contribute to breaking the doctor's trust with the public.
You want any particular goodies or anything? I got a spare bag for you.
The influence of the pharmaceutical industries can be very subtle and can be very appealing actually at the same time. There are house staff, that is residents and faculty, are human beings. House staff in a hospital like Jacobi would rather have lunches provided by pharmaceutical representatives than to eat at McDonald's or food that comes from the cafeteria.
Doctors don't read the medical literature, and that somebody who comes in with a free lunch or a gift or an invitation to a sporting event and asks them and tells them that this is a better drug than what they're using is a far more powerful message. It should be the other way around. We should read the New England Journal. We should be able to cite that data, but practicing doctors just aren't there.
The physician is, I believe, trying to think about the patient. The problem is that the information the physician gets is very one-sided and is surrounded in these trappings of, pizza, dinners, little gifts, trips, vacations, and the like that cloud their judgment.
You all have a video, and it blows my mind. It says, quote, "Let's listen to part of Martin Luther King's I Have a Dream speech." Then you show the video. How many times did he repeat the phrase, "I have a dream"?
I have a dream. I have a dream. I still have a dream.
And then they go on to say, just as with a physician, you must keep repeating the compelling message. At some point, the physician will be free at last when he or she prescribes the Merck drug.
Free at last. Free at last. Thank God Almighty. We are free at last.
Is that the way you all sell these drugs? Is that what you teach these salespersons to do?
What we teach our salespersons to do is to follow the policies and procedures that we have in place.
Is this a part of the policies and procedures?
I am confident that those policies and procedures and our training methods for them ensure that our representatives present to the physicians the information in a fair and balanced manner, and that it is accurate. I am not familiar with the documents that you are all reading from.
Pharmaceutical representatives have been so-called pushing medications that are not necessarily the optimal medication for treatment.
Don't you assume that the physician is getting accurate information about the drugs that he may be prescribing for your father or my father or someone else's father?
To my knowledge and how Merck approaches it, I think we are providing accurate, balanced information regarding our products, yes.
You just keep saying a lie over and over and over again, people believe it.
Merck, where patients come first.
If we're trying to decide whether to buy a Toyota or a Honda, for example, we don't ask the Toyota dealer which is better. But somehow drug companies have managed to convince people that they are unbiased, that they both are selling something, that they're maximizing profits like any investor-owned business does, and at the same time they're providing disinterested information. That's absurd.
Professors for hire. Would a doctor ever sell out his patients to drug companies and promote drugs for money?
The doctors themselves should know better than to just dispense medicine like that to people.
Why did doctors write so many Vioxx prescriptions, even as evidence of harm mounted?
Was all of this prescribing happening only because of gifts and lunches? Not all doctors get their information from drug company reps. Doctors go to medical school for years, then take courses, go to lectures, and doctors learn from distinguished professors, experts in the field.
I think it's easy to overestimate doctors' scientific credentials. Doctors now get most of their education about prescription drugs, how to use them, when to use them, what to use them for, from drug companies. The medical schools and the profession itself have, to a large extent, abdicated their responsibilities to educate doctors.
A conservative estimate is that pharma spent $20 billion on drug marketing and promotion, or as pharma prefers to call it, educational outreach. During the same time, all the U.S. medical schools combined spent only $3.5 billion educating doctors.
The pharmaceutical industry has taken over the doctor profession.
If they can get these thought leaders lined up, then they have an effect on doctors far beyond their numbers, since they do write the papers and they speak at the meetings that are sponsored by drug companies. So the drug companies are very, very nice to them. They hire them to speak at meetings in nice places. They go to resorts in Hawaii. They talk to other doctors that are brought out there. They're handsomely paid and generally courted. They're flattered incessantly. After a while, they think they walk on water because the drug companies are kissing their ring all the time.
These are doctors, professors, teachers. These are people who are very prominent, who, in my opinion, have totally corrupted themselves and take money from drug companies to promote drugs.
The most efficient marketing tools are the ones where the physician doesn't necessarily notice that he is being marketed to.
Experts in the field are paid by companies to not only market the drugs, but market them in such a way that instead of looking at what they're saying as marketing or advertising, it's done as science.
The company obviously knows which doctors are favorably inclined to its drugs. You have somebody who doesn't speak well about the drug, you're not going to hire him again to do another speaking engagement.
One of the reasons the pharmaceutical companies really pursue the thought leaders is because of how other physicians perceive them. And in essence, when they are able to vouch for a product or to recommend a product, they become the ultimate rep for that company, the most credible rep for that company.
Once you've shown your expertise, the drug companies come after you, and with their checkbooks, they start hitting you over the head and shoulders with their checkbooks. And they say, oh, come and do this for us, come and speak for us at meetings, come and do a continuing medical education course for us, come and help us out, do some advising on some research that we're doing. And with one thing or another, most of the doctors and scientists who you find are in these positions of power are also having financial relations with the drug companies in their field of expertise. It's a terrible, frightening thing that's happened to medicine in this country.
They call them consultants, and it's a way of getting money to them and winning their hearts and minds. And the same is true for people who are writing guidelines. They are the ones that the drug companies most want to hire as consultants.
These guidelines from the American College of Rheumatology recommend that Vioxx and Celebrex be used as the first-line anti-inflammatory drugs for joint pain. An internal memo of Merck had a notation next to the name of the author of these guidelines. The notation said, "Show me the money."
Show me the money! Show me the money!
Physicians are like anybody else. They like money.
Molding clinical trials. Clinical trials are the key to proper patient care. Can science be manipulated? Can the results of clinical studies be changed?
A drug trial done by a pharmaceutical company is 5 times as likely to show a positive result for the particular drug than a drug trial conducted by the NIH. And there's a reason for this very clearly.
The drug companies basically design the trials, they interpret the trials, they analyze the data, they can manipulate the data in such a way as to show that this trial shows a certain thing, whether it be that there are no adverse effects for this drug or not. But the drug companies are basically in charge of molding what those clinical trials that they design themselves say.
These are scientists of great reputation and ability, and so therefore are not likely in any way to compromise their own integrity of ethics or their scientific standing.
In this article published on December 28, 2005, the editors of the New England Journal of Medicine call into question the integrity of the Merck-sponsored authors of the Vigor trial. The title is Expression of Concern. 3 heart attacks, all in the Vioxx group, were not included in the data submitted to the journal. These inaccuracies and deletions call into question the integrity of the data. Influencing advisory committees. Where does the FDA go for unbiased advice on drug side effects?
The FDA has an advisory committee structure, panels of experts that it will turn to for advice on drugs. Unfortunately, the members on those panels frequently have financial arrangements with drug companies. They own stock, they're on the Speakers Bureau, or they've even done clinical trials for the companies so that they've gotten money from the companies.
The drug companies know where they're putting their money. They put their money, for example, in members of the FDA advisory committees. Most of them are on the payroll of drug companies as consultants, and they, I'm told, get unusually high consulting fees.
So you've got people who are paid by the companies sitting on these FDA panels saying to FDA, approve that company's drug. It's a very bad system.
The Vioxx case, please keep in mind that an advisory committee that met in 2001 that included people from around the country who were experts in this gave us the advice that the risk-benefit profile of this drug was sufficient to allow it to stay on the market. So this is the advice that we were getting in 2001 from people who knew
And isn't it
about
true
this
that
study.
people on that advisory board had ties to the drug industry?
I don't think that the ties or not ties or connections with the industry impacted the quality of the advice that we got.
Money always influences you and what you say or what you don't say.
People on that committee who were paid by a company were 16 times more likely to say keep the drug on the market than the people who didn't get money from industry.
Money is good. Money is good. And intelligence does not exempt you from greed or from human nature.
Industry owns the advisory committees as well. It owns FDA's consultants.
Neutralizing doctors. How does Big Pharma deal with doctors who try to warn patients about drug side effects?
Can you explain what was going on? What does that mean, neutralizing a physician?
What it means is that we feel that when physicians have either lack of information or misinformation about our products, that it's important to make sure that they have full understanding of both the benefits and limitations of our products. And the intent here is to provide them that education so we can bring them back to a more neutral, balanced position about our product when they consider it for their patients.
This isn't about neutralizing it, it's to mislead them and downplay what they're feeling are major concerns about something that might impact on their patients. This isn't neutralizing, it's worse than that.
Medical schools receive large grants from pharmaceutical companies. These companies may expect favorable reviews of their drug in return.
When researchers published articles or gave speeches that presented misleading or inaccurate information about Vioxx, Merck sought to set the record straight.
Dr. Gurkapal Singh, a professor at Stanford, tried to tell doctors and patients about the bad effects of Vioxx on the heart.
And I was warned that if I continued in this fashion, there would be serious consequences from it. I was told that Dr. Lou Sherwood, who was then vice president at Merck, had become very interested, in quotes, in what I was doing, and that Dr. Sherwood is very powerful, and he's going to crush you, and he's going to fix you.
I'll be back.
I don't want to be neutralized, and the fact that they've got all of these tools suggests that this is not education, this is social manipulation.
The revolving door. Enter the FDA. Play along. And
We have what is called a revolving door, that somebody who works at FDA can then turn around and now go work for a drug company and make 2 or 3 times as much money. And so one does have to wonder, could the decisions that people are making at FDA be influenced by the fact that they're thinking, a year from now I want to go work for a drug company. If I make this decision and it hurts a drug company, well, a year from now they're not going to want to hire me.
doing your job at FDA. What happens to FDA scientists trying to protect patients from deadly drugs?
At the time that I was preparing to testify before the Senate Finance Committee in November 2004, there was a conspiracy, an orchestrated, organized conspiracy of high-level FDA officials to discredit me and to intimidate me. It was Dr. Galson, our Center Director, who telephoned The Lancet. The Center Director tried to ruin my career by lying to the editor of The Lancet. Now, the editor of The Lancet knew it was a lie, and he caught the Center Director in the lie.
Dr. Richard Horton, the editor of The Lancet, wrote, "With Vioxx, Merck and the FDA acted out of ruthless, short-sighted, and irresponsible self-interest."
The commissioner of FDA offered me a job so that I wouldn't testify. And then, when I turned the job down, Dr. Crawford issued a press statement that basically was intended to threaten me so that I wouldn't testify.
So the clarifications provided last night by Dr. Crawford appear intended to intimidate a witness on the eve of a hearing. So Dr. Crawford knows there's a problem and would better serve the FDA by spending time on the problem rather than going after congressional witnesses who helped identify the problem in the first place.
That's a federal crime as well. To intimidate a witness before Congress, that's a crime.
This committee takes its responsibility to protect witnesses, and particularly government witnesses, very seriously, and that holds particularly true for Dr. Graham. I just want to be sure that you understand that, okay?
Mr. Grassley, we take that very seriously.
And then the weekend after I testified, high-level FDA officials decided that they were going to fire me the following Monday. I telephoned one of Senator Grassley's staffers, and 7 o'clock Monday morning, they were working on FDA to basically intercept this action that they were going to take against me.
Our experience with the FDA is that they're very data-driven, they're very rigorous, and they're very concerned about patient safety, and so that, and they're, as a result of that, they're a very effective regulator, they're a very tough regulator.
Here you've got FDA trying to defend a killer drug that they put on the market and that they kept on the market, and they were willing to go to extraordinary means to discredit a scientist who had the misfortune of stumbling onto the truth. Fear was a big operative, and pressure. The people at the first level managers are pressured by the second level, who are pressured by the third level, who are pressured by the, it just rolls downhill. And they're all taking their commands from very high up to be soft on industry.
I believe that Merck acted responsibly once the problem was recognized.
That's all I want to know.
In my view, FDA is what we would call a captured agency. It has been captured by industry. Industry controls FDA. So they have responsibility. In my Senate testimony, I talked about 500 or 1,000 airliners dropping out of the sky over the course of the drug. That's how many people were killed by the drug. 1 or 2 a week. 1 or 2 jetliners a week were crashing. That's how many people were dying from Vioxx. And FDA, as the responsible government agency for safety, didn't care and did nothing.
I think the fault lies mainly with the FDA.
Do you personally take any kind of responsibility in what happens to American consumers as a result of the FDA not being strong enough in dealing with these companies?
Gentlemen's time's expired. If you want to answer that, you can.
Of course I do, as do all the other 2,000 incredibly dedicated people in the drug center.
That's one of the wonders and the beauties of bureaucracy, which is that responsibility is parsed out into a million little pieces so that no one has responsibility. So the bureaucracy can hide. You can have people who make bad decisions that cause thousands of people to die, and yet no one's responsible. FDA had a moral obligation to the American people, and it did not deliver. Instead, it sided with industry, and it was the cost of doing business. What's a few thousand dead Americans among friends? That's basically FDA's attitude. What's a few thousand dead Americans among friends?
She died of a sudden heart attack
less than a month after she started taking Vioxx. She was buried on the very day Merck took Vioxx off the market.
Behind the scenes, why isn't the FDA protecting the American people from harmful drugs?
The Center for Drug Evaluation and Research at FDA, where the drugs are approved, more than half of that budget for that center is paid for by industry. So industry is actually paying the salaries of people in FDA. Well, if industry's paying your salary, who do you work for? You work for the guy who's paying your salary. So FDA works for industry. Congress should be acting. They should be reacting to this. We just had a Vietnam happen right under our noses. 60,000 people are dead, and what's Congress going to do about it?
What you have with the drug companies is corporate America at its most powerful, most influential.
The pharmaceutical companies used to have about 600 or 700 lobbyists in Washington, more than one for every member of Congress. Now they have over 1,200. They've doubled the number of lobbyists in a couple of years. One of the senators said you can't throw a cat by the tail in Washington without hitting a pharmaceutical lobbyist. It tells you something.
Drug companies are very good at aligning support, and they do it by money. So they contribute money to all politicians, Democrats and Republicans in the House and in the Senate, so that they've got friends in political high places.
From what I see, you acted responsibly, and having known you for a long time, I know that you would never countenance having a drug that was non-efficacious in the marketplace if you knew better. I want to compliment you for doing what you did as soon as you knew what to do.
If the American people knew that the American Congress has been bought off by industry and that they're paying for it with their lives, I think that they'd be quite upset.
How could you put a price on a healthy person having a heart attack? You can't restore the heart.
The others. Is it only Merck? Is Merck the only bad apple?
It's only by luck that Vioxx was identified, and it's only by luck that the drug came off the market. It's only by luck that only 60,000 people died and not 200,000 in the United States. It's only luck.
It's not just Vioxx. Vioxx is the most famous one.
I think it's important that we not just have Merck, but we hear from these other companies as well. We ought to get the documents from them.
I want to know about them. We just heard Dr. Wilkes say that the other companies are worse. So we really need to hear from them.
With Celebrex, I will not give in.
I will not give in. I will not give in to the joint pain of osteoarthritis.
Pfizer is selling Celebrex, the sister drug of Vioxx. More billions spent on a drug that increases the risk of heart attacks and strokes. Pfizer had a 12-month study but decided to publish only data from the first 6 months so Celebrex would look safer than it is. Pfizer failed to inform patients about the risks of Celebrex.
That's one pill, 24 hours.
It was only after 7 years of selling Celebrex that a black box warning about heart risks finally appeared. Other companies oversold drugs to patients with AIDS, cancer, and everything else. As a result, hundreds of thousands of patients had side effects from drugs they did not need.
Almost half of them have been fined or pled guilty or reached some other agreement with the Justice Department or the FDA that has usually involved tens and more often hundreds of millions of dollars. It goes on and on and on.
For every Vioxx that we identify, there's other things that are getting by.
The women. How did Big Pharma sell cancer and strokes to women for 60 years? In a former British colony, most healers believed that fluids extracted from the urine of horses, fed to aging women, could preserve youth and ward off diseases. The preparation became enormously popular. Modern scientific studies revealed that the horse urine caused tumors, blood clots, and heart disease. The former colony is the United States. The time is now.
If menopausal symptoms are disrupting your life, Premarin is approved to treat symptoms and prevent bone loss.
The doctors and scientists thought that was very funny. Premarin stood for pregnant mare's urine. But of course, the women were never told that's what it stood for. And actually, when women found out what it was really made of, many women got very upset. They really didn't find that too appetizing. It was described like a total fountain of youth, but instead, it was a fountain of youth for the drug companies. It was the estrogen companies that did this first and perfected this kind of research by press release. They worked with the same PR companies that had defended the tobacco industry for many years. In the 1990s, when it had already been on the market in the United States since 1941, Premarin became the #1 best-selling drug in the United States. It was amazing.
I'm soaked, I'm dry, I'm cold, I'm hot.
I'm not. My doctor prescribed Premarin.
The story of this drug is the story of the triumph of marketing over science.
Isn't it time you asked about Premarin?
I'm so ready.
Promise her anything but give her cancer.
After 60 years of selling Premarin, this 2002 National Institute of Health study showed that estrogen therapy causes heart attacks, strokes, and cancer.
It may increase the risk of heart disease, heart attack, stroke, or dementia. Estrogen increases the risk of uterine cancer.
The children. Would anyone ever sell dangerous drugs to children just for a profit?
The controversy over the use of antidepressants in children is of great public interest. Over 10 million children a year are prescribed antidepressants in the United States.
She wanted to be an English major, and I was an English major in college. We were going to visit her uncles and have a family reunion in the Midwest, and we were stopping to see 5 different colleges. We had appointments at the Honors College at a couple of them.
We're never going to see our daughter graduate from school. We're never going to see her meet with someone and someday fall in love and have children. We'll never meet those grandchildren.
Tom went into the garage to get the luggage, and that's where he found her, and just shock.
Zoloft, a prescription medicine, works to correct this imbalance. When you know more about what's wrong, you can help make it right.
Far back as 1996, 8 years ago, the medical reviewer at FDA, Dr. James Knudsen, raised the question of an increase in suicidality in pediatric clinical trials of a drug called Zoloft.
Now, the FDA did manage to get a committee together.
Out of 100 patients treated, 2 to 3 patients on average will have an increase in suicidal behavior or ideation after initiation or changes in treatment, period. So that people say, well, what does this really mean? It means if they give 100 people the drug, they got to watch out 2 or 3 times.
What happened between 96 and recently? Did the FDA, specifically in your written request, ask for exploration of this question, suicidality? No, the answer is we did not.
Someone holds back information that would have prevented the physician or the psychiatrist or the family from giving that child this drug, yes, they should be criminally prosecuted. They are a building. This was a beautiful child, and she was denied the right to live by Hank McKinnell and all these other CEOs who just want to make money over the lives of children. And that is wrong. No matter how you look at it, that is wrong.
And if you need medicine, Pfizer will be there.
Mr. McKinnell has 4 children, and I'm sure he loves those 4 children very dearly, and is look forward to seeing them grow up and live successful, happy lives and be productive. We also had 4 children. The oldest of our 4 children, Julie, died as a result of taking a drug produced by the company that he manages.
He should think more about people and less about profits. And if he had that right way thinking, if he would do the right thing for people and not just his shareholders, then Julie would still be alive. He didn't need to sell all that extra Zoloft.
Talk to your doctor about Zoloft, the #1 prescribed brand of its kind. Zoloft.
If they increase the risk of suicidal behavior in children, and they don't work for depression in children, why on earth would you want them to be used in children? Well, the only answer I can come up with is it's because industry's making a lot of money selling these drugs to children.
To withhold a warning from the drug, to let parents know and to let doctors know that these drugs can make you agitated and make you suicidal, to give the parents and the doctors a chance to take that person off these drugs before they attempt suicide, that's the worst injustice out of everything.
On our bottle it just said dizziness, but now there's a black box that it may cause this risk.
Final act. Now, just for fun, some real good acting.
I believed wholeheartedly in Vioxx. In fact, my wife was taking Vioxx, using Vioxx, up until the day we withdrew it from the market.
My own father was taking Vioxx until we voluntarily withdrew it from the market.
This Merck training document instructs pharma reps to involve their grandmother when selling drugs.
I'm proud that we followed that same rigorous scientific process at every step of the way with Vioxx.
Poor Mr. Gil Martin, or whatever his name is suffering from, self-deception. I mean, he doesn't want to believe that. He does not want to personally feel responsible for all those people who died. And he is personally responsible.
We can't even dance anymore.
Yeah, we used to be big dancers, him and I.
We used to enjoy dancing. That was one of our favorite things. When we went to gatherings of the brothers and sisters, or no matter what, we would dance. We would be the first one up on the floor. No more.
No.
Numbers are always what's most important. If you have a choice between numbers and reputation, today executives probably choose the numbers because they care about next quarter, not the next 10 years. It didn't used to be like that, and that's the reason Merck, for instance, had a very good reputation in the past. And they're probably the last drug company that now lost a reputation.
I think it's criminal. I think it's people's lives are in their hands, and they're only thinking about making a dollar. They're not thinking about the patient.
Merck made billions of dollars off Vioxx while they were marketing it. How much of it they're going to have to give back? That's going to be up to the courts to decide. So you can kind of see how it all in the end boils down to dollars. It all reduces to dollars.
And all that for a few dollars more.
All of them should be put into jail, in prison. They're just, to me, they're like murderers.
Why aren't the CEOs of companies like Merck brought up on homicide charges, on criminal charges? I mean, to keep quiet, to hush up the fact that a lot of people are dying from a popular drug that you're making a lot of money on.
How many people died because of the Vioxx thing? That's murder, and people should go to jail for murder.
You have Enron, where people go to jail for 25 years. You have other companies where people have died and nobody goes to jail.
What the CEOs and the higher-ups at the pharmaceutical companies have done in playing with people's lives and manipulating data to increase profits for their drug companies is much worse than what someone like Ebers did, or any of the accounting scandals that are out there. It's much worse.
Merck, where patients come first.
Pfizer, working to keep America healthy.
I happen to support what I call benevolent capitalism, and that is the kind of a thing where it is very good to make money, but you always have to make money and do so within the framework of being honest and not being venal and not being a hog. The pharmaceutical industry is venal, they are hogs, and they really do not care for the public interest.
The aftermath.
I'm just a single employee. I don't have the control if I keep my job or don't keep my job. Pfizer does. Pfizer makes the decisions.
Dr. Peter Rost was fired by Pfizer on December 1st, 2005, 2 months after this interview.
If I fell down on your sidewalk and there was ice there, I wouldn't sue you. That's my principles. Because although I would have every reason to do it, I just feel I'm just against doing that. But I don't blame people for suing if they want to.
Mrs. ID continues to live with her husband of 51 years, quietly bearing all the consequences of her heart attack.
We acted responsibly and in a manner consistent with Merck's commitment to patient safety and to our rigorous adherence to scientific investigation, openness, and integrity.
In May 2005, Mr. Gilmartin resigned with $100 million in stock options. He can now enjoy retirement, unlike 60,000 Americans.
We have the capacity to stop a company from selling a drug that's unsafe. The assessment of whether a drug is unsafe is obviously very complex.
Despite his role in the Vioxx disaster, Dr. Galson continues to head the FDA Office of New Drugs. Dr. Crawford resigned as FDA Commissioner on September 22, 2005. He then jumped through a revolving door. Dr. Crawford is now at Policy Directions, a lobbying firm serving Merck's interests.
These people can smear my name, can threaten me, can cause lots of psychological harm to myself, to my wife, to my children. A lot of harm was done, and the way the system is set up, those people walk away scot-free and able to do it again.
Dr. David Graham continues his work at FDA to ensure that the American people receive safe drugs.
On a land where life had no value, death might have a price.